vitamin D, vitamin K, and your ideal wellness. Before we start with that, disclaimers, important messages. Number one, check with your doctor before you take any supplements, particularly if you're taking any pharmaceutical medications or anything over the counter on a regular basis. You want to check out if there's any negative interactions between something new or something you're going to increase. Specifically with vitamin D, if you have sarcoidosis or other granulomatous diseases, that is a counterindication to taking any vitamin D. So you cannot take any vitamin D if you have sarcoid, okay? Next is, before you take vitamin D, I recommend that you get your level checked. Easy to do. Lots of doctors are doing it now. If you have an upcoming blood test, you can just check in with your doctor, nurse practitioner, whoever it is, and just say, can you check my vitamin D level, if it's not already checked. If you've had it checked in the past, go get that number, have it rechecked, see where you are, okay? Most of the time, vitamin D is measured in nanograms per deciliter, Ng/dl. You don't need to remember that unless you're having the other method of measuring it. Nanograms per deciliter. If it's nanomoles per liter, you have to do a conversion. Worry about that some other time, and it's easy to do. Just go to Dr. Google and they'll figure it out for you. The number you're going to get is a whole number, let's say between 0 and 100. Hopefully you're not 0, and it might not be bad if you're 100. But most of the patients that I've tested over the past 10, 12 years have been around 15 to 35. That's way too low. That's too low. The lowest level I've tested in my office is 9. The lowest I've ever heard is 3 in a child. That's really, really low. The ideal level, most people agree, is somewhere between 50 and 70. I'm going to go over those numbers in a moment as I go through some more of these references and so forth in these doctors. This is a key point. This is why you're taking vitamin D and vitamin K. By the way, a lot of the supplements now combine the two, right? Vitamin D and vitamin K together. More than that, there are some, you want to be careful not to take vitamin K if you're taking blood thinners, specifically Coumadin or warfarin. You want to check with your doctor. You can take some, but check with your doctor first. Don't take any vitamin K if you're on a blood thinner until you check with your doctor. Low vitamin D is linked. Now, I'm not saying that this is a cause, but low vitamin D is linked to heart disease, 17 forms of cancer, including breast cancer, autism, Alzheimer's dementia, Parkinson's, diabetes, a whole host of autoimmune diseases, including lupus, type 1 diabetes, and multiple sclerosis, infertility, chronic pain, chronic fatigue syndrome, frequent colds and illnesses, depression, headaches, fibromyalgia, weaker bones, osteoporosis, premature birth, and poor mental function, among others. That's why it's so important to take vitamin D, okay? This was a 2005 study on breast cancer. It showed that women with vitamin D levels above 60 nanograms per deciliter, milliliters, have an 83% lower risk of breast cancer compared to those that have levels below 20. If you're a woman and your vitamin D levels is above 60, compared to a woman that's below 20, you have an 83% lower risk of breast cancer. Those are some pretty big numbers. I'm going to have references in the show notes afterwards. You're going to see those. We'll put them up on the screen now. A couple of really good references if you want to go for more on vitamin D. vitamindcouncil.org, vitamindcouncil.org. Another one is grassrootshealth.net. Dr. Mercola, mercola.com. He has a lot of references on vitamin D, so you can check out his information. As we get into this, I just wanted to give you this quote about supplements in general. Now, why do people need supplements? If you would ask me that question 20, 21 years ago, I would say, no, people don't need supplements. Just eat good things and live a healthy lifestyle and go to your chiropractor and get exercise and reduce your stress, and you'll be fine. Eat a clean diet and so forth. Maybe that was true some years ago, but This is in Dr. Daniel Amen's book, The Brain Warrior's Way. He is quoting Dr. Mark Hyman. Many physicians say that if you eat a balanced diet, you do not need supplements. Here's the response. If people eat wild, fresh, organic, local, non-genetically modified food grown in virgin mineral and nutrient-rich soils that has not been transported across vast distances and stored for months before being eaten, and work and live outside, breathe only fresh, unpolluted air, drink only pure, clean water, sleep 9 hours a night, move their bodies every day, and are free from chronic stressors and exposure to environmental toxins, then it's possible that they might not need supplements. That's a good summary of why we do. I have 3 newsletters of vitamin D on my website, drscottfuller.com. You can read about those. This is a quick introduction to them. A couple of these are repeat. I just want to make sure I cover this. Vitamin D deficiency is linked to cardiovascular disease, strokes, cancers, autoimmune, loss of cognitive function, diabetes type 1 and 2, decreased strength, depression. Deficiency of vitamin D is now recognized as a pandemic with more than half of the world's population at risk. So that's a huge number. 50% of healthy North American population and more than 80% of those with chronic diseases are vitamin D deficient. I would agree with that. Virtually every person I've tested, myself included, was vitamin D deficient until we supplemented. Those with vitamin D deficiency experience 39% higher annual healthcare costs. Your costs of healthcare go up by 1/3 if you're deficient. This was important about cancer, more on cancer. Raising the year-round blood levels of vitamin D to 40 to 60 nanograms per milliliter would prevent 58,000 cases of breast cancer and 49,000 cases of colorectal cancers per year, and prevent 3/4 of deaths from these diseases in the US and Canada. These levels could reduce case fatality rates of patients who have breast, colorectal, or prostate cancer by half, which means if you get diagnosed but your vitamin D levels are better, you have twice as likely chance of living through that and getting better. Interesting. Okay. Here's some references. I have a bunch. We'll pop right through these. Here is an article out of the journal Aging in 2016. Now, this is going to be Dr. Dale Bredesen. Dr. Dale Bredesen wrote the book, The End of Alzheimer's. The End of Alzheimer's. And in this book, he talks about preventing Alzheimer's. Yes, preventable. Not in all cases, but yes. He also talks about if you get Alzheimer's, you can get better. Yes, you can get better. I'll be doing a show on that in the near future, right? Anyways, this is a research article that he helped author. Alzheimer's disease is one of the most significant healthcare problems nationally and globally. I agreed. If we don't turn the tide on Alzheimer's, Alzheimer's by itself is going to sink, completely destroy the healthcare community in this country, because we just won't be able to pay for it anymore by 2050, and I've done shows on that in the past. So he has a variety of recommendations in his protocol of dealing with Alzheimer's, including exercise, including cognitive work, including nutritional recommendations, and he has a whole pile of supplements. One of them is vitamin D, and he says supplementing with 2,000 to 5,000 IU of vitamin D daily. He says even more if you've been diagnosed. 5,000 IU per day, year-round, for an adult is about right. I agree with that. That's what I've been doing with my patients for at least 15 years now. This is out of Dr. Bredesen's book, Dale Bredesen's book, The End of Alzheimer's. A little bit about vitamin D. Reduced vitamin D activity is associated with cognitive decline. It's as simple as that. Your brain doesn't work right if there's not enough vitamin D. Vitamin D travels through your blood and tissues like a Wi-Fi signal entering your cells. Once inside, it binds to a receptor molecule, the vitamin D receptor, to turn on 900 genes. So vitamin D has a very powerful epigenetic effect on the health and expression of the genes that you want from each cell in your body. And if I remember correctly, all of the cells in your body have vitamin D receptors. So it's very important to make sure that your vitamin D levels are adequate and they stay that way year-round. In the book, The Plant Paradox by Dr. Stephen Gundry, another great book, and I do recommend that as a read for you as well. He has recommendations of vitamin D. He agrees that about 5,000 international units for an adult year-round, unless you're getting some adequate sun, is appropriate. I believe you should be testing yourself and retesting yourself to monitor. He says one of the base situations of chronic diseases in the world is a leaky gut. And part of his protocol to heal the leaky gut is as follows. To heal the gut, one must stop the damage, rebuild the microbiome with probiotics and prebiotics, fermented foods and so forth. I agree with that. And to elevate vitamin D to 100 nanograms per milliliter. Not a lot of doctors are going to agree with that, but he's saying you need to increase it to that amount. And again, this is vitamin D3, of course, not the synthetic type that's added to foods. Most of the foods, including dairy products that are vitamin D fortified, are fortified with vitamin D2. That's not going to work for you. Here's Dr. Dan Murphy talking about his recommendations of levels for vitamin D3. Infants, 400 IU, so much smaller now. It's body weight determined. 400 IU per day for infants. Pre-puberty is 2,500 IU per day for children. A rough guide that I use in my office is 1,000 international units per 25 pounds of body weight. So if you're 25 pounds or less, that's 1,000. If you're between 25 and 50 pounds, that's 2,000. 50 to 75 pounds, that would be 3,000 IUs per day of vitamin D. 75 to 100, that would be 4,000 IUs. And then over 100 pounds, then you're at 5,000, maybe more if you're much larger. And then adult is 5,000 IU per day. Tying in the vitamin K situation, vitamin K is one vitamin K tablet of this particular formula that we use in my office per day. If you're on a statin drug, they're saying double your vitamin K. Remember, if you're on a blood thinner medication, you check with your doctor before vitamin K. Just a little bit on vitamin K, because I don't want to overload you with information. Without vitamin K2 and K24 and K27, calcium is deposited into arteries. So the situation is vitamin K signals calcium where to go. Where do we want calcium? We want it in the bone. Vitamin K helps signal calcium to go to bone and then not into your organs, soft tissues, and arteries, which would be called calcification of organs and arteries, and that's not a good thing. And a lot of doctors are saying we've got to stop people taking all these calcium supplements. Vitamin D is shown to outperform mineralization of bone than just taking calcium. And then vitamin K is important because it directs the calcium where to go. Without vitamin K, calcium is deposited into arteries, joints, and kidneys. Those on statin drugs often need to double their vitamin K supplementation, but remember, if you're under a blood thinning medication, you have to check with your doctor before you're taking vitamin K. And before you do take any vitamin D, I recommend you get your levels checked just to see where you are. You can also do some experimentation like I've done, which is on my newsletters on my website, where when I determined my levels were low, I actually took 10,000 IUs for a little while, retested, got it into a good level. Over the summer, because I'm a cyclist and a runner, I was getting some sun, and at the Boston latitude, by the way, we only have 4 months of adequate sun that will produce vitamin D. That means 8 months a year, even if it's hot and sunny, you're not getting any vitamin D, and that is 2 months before the summer solstice and 2 months after the summer solstice. So say approximately April 20th to August 20th. That's the window in the Boston latitude of sunlight that's adequate to produce any vitamin D. But most of us are stuck inside during the noontime hour, which is when you need to be out there. Plus, we've all been told, be careful of the sun, don't go out with sunblock and so forth, and shade yourself. I think most people, unless you have a super sensitivity to sun, should try to go out in swimsuit attire and try to get a few minutes until you just get a little bit pink. No sunburns, but a little bit pink. Again, if you don't have a big sensitivity to sunlight. and with your dermatologist directions and blessings, that you get a little bit of sun natural vitamin D protection. So with all of that said, you can play with your levels. So what I did several years ago is I went to 5,000 IU with the summer and then getting some sunlight, and I found that my levels either stayed the same or even dropped. So I had to up through the winter months, so that's something to consider. That's a little bit on vitamin D and vitamin K. I'm Dr. Scott Fuller. Thank you.